Only ventilators were saving people at the time.
Actually, some studies showed the ventilator mortality rate was as high as 90%. Do you know far into the pandemic, there's a paper, I think, from Johns Hopkins, far into the pandemic, in 2023 or so, the ventilator mortality was still 40%. So the ventilator was not saving patients. The McCullough Protocol, which became the most widely used treatment platform, on Earth, because I was out promulgating this, and I had a major society behind me. The McCullough Protocol is credited with saving worldwide tens of millions of lives and sparing hundreds of millions of hospitalizations. At the Wellness Company, we formed a whole company out of this. We make emergency medical kits with McCullough Protocol. The vaccines didn't save a single life. It was early treatment that saved lives. You almost died because you didn't get early treatment.
Yes.
If you would have got early treatment, it would have taken an edge off it, and you would have gotten through.
Would you advise people to continuously take the vaccine, the COVID vaccine now?
No. I mean, early on, when we saw people dying immediately after the COVID vaccine, I testified in the Texas Senate in March of 2021. That's early. We had about 1,600 vaccine deaths at that time in the United States. 1,600? Imagine if we had 1,600, ibuprofen deaths or something. 1,600? I said, listen, I have to question this.
And the number one thing it causes is blood clot?
The two is heart damage causing cardiac arrest and blood clots. That's proven.
How did they not test the vaccine on any person, on any animal, to see if there's any side effects before just giving it out to the public?
They were rushing through the clinical program and the standard testing. So there's standard cardiotoxicity testing where you just actually tested on some heart muscle cells. That was done, by an independent German lab. And for sure, Pfizer and Moderna are toxic to heart muscle cells. If you do that today, you'd say, no, that drug should not be going into humans. But no, the cardiotoxicity, the genotoxicity, teratogenicity, oncogenicity, biodistribution, none of the testing was done for the COVID-19 vaccines. But listen, we've had 5 years of this. They could have tested it for the boosters, still not done. Moderna's rolled out an RSV vaccine. There's no emergency. They skipped all that testing too.
So you're telling me the current boosters and the current COVID-19 vaccine is identical since its inception? Nobody, retested it, reinvented it, made it better to make sure it doesn't affect?
It has not been made safer. Now, the genetic code for the spike protein has changed from the original Wuhan to some variants. In fact, it's even worse, Joe. The boosters, when they come out, they're not even tested at all in humans. They're just tested in animals to say, well, there's an antibody rise against this spike protein. They wave it off.
You're a very intelligent man. I have a different analogy besides, spreading the virus, and to see how the government can, do this. I want to understand, and I want to have your take on this. Do you think there is also an intention to see how the government can control its people, the public, to see how they would react? How far would they push against the government? For instance, having that 10 feet apart, 5 feet apart thing, not going into churches, not going into restaurants, having a bunch of closures, no school, no nothing. Do you think the governments around the world, I'm not speaking only about the United States, are testing to see what would be the reaction of the public? How far would they push just in case if they want to have something bigger, better, more outrageous than COVID-19?
Joe, we didn't talk before we got on the show, but did you just come back from the World Economic Forum?
No.
Did you? Come on.
No.
Just tell us the truth.
Yeah.
Were you in the crowd?
No, I was not.
You weren't?
No.
That's exactly what was said at the World Economic Forum.
Really?
It was said the COVID-19 pandemic was a test of global compliance. Would you comply with a directive, a government directive? It was a test. And, and things we had it pretty easy.
And I think we passed the test.
In the United States. So listen, in the United States, we had it pretty easy. Some places, it was rough. I had friends in Paris that said, listen, I've got to get an affidavit to leave my house and get some groceries. I had friends in Australia. Ultimately, I visited Australia. And they said, Doc, we had a 5-kilometer radius around our house. as if the virus is, going to pay attention to, radial divisions. It was a test of global compliance, at least according to the World Economic Forum.
So it's interesting. Why would they just, speak about it so simply and
And openly.
openly,
Well, in my
into people's minds after the pandemic?
well, listen, in my book, and this was we wrote this in 2021. It was published in 2022. The subtitle here, and this is what I was doing: preventing hospitalization and death while battling the biopharmaceutical complex. So, what is the biopharmaceutical complex? What is this? And in our book, we outline that over time, in this era of biological threats and countermeasures, this last decade of rich research, lots of government money, tons of government money, a consortium or a complex or a cartel has formed. And there are powerful players in here. At the top, we think, is the World Economic Forum, the World Health Organization, the Gates Foundation, the Rockefeller Foundation, the Wellcome Trust, Gavi, CEPI, the Coalition for Epidemic Preparedness and Innovation, founded by Gates and World Economic Forum. All the regulatory agencies are involved. So we have the US FDA, the NIH, the CDC. In the UK, we have MHRA. We have SAFRA in South Africa. We have the regulatory group in Australia, the EMA in Europe. They were all carefully coordinated here, and again, richly funded. When I mean richly, do you have any idea how many people work at the US CDC?
No.
Or what their budget is?
I'm sure it's a massive budget, but I don't know how many people work there.
We're talking, I did my residency at University of Washington in Seattle, one of the top places in the country. Many of my fellow residents became CDC officers. We're talking people equally as competent as I am.
And I assume very well paid.
Probably reasonably well paid. But you know how many of them?
No.
12,000.
12,000 CDC employees.
CDC, $9 billion budget.
That's a big budget. Yeah.
Now, they don't take care of any patients. They don't run any hospitals. They largely are there to give me advice as a doctor.
Centers
Give
for
guidelines.
Disease Control.
Can you imagine that? $9 billion, 12,000 employees to give some advice? This is mind-boggling.
Maybe you chose the wrong profession.
No, but this is mind-boggling. Well, they do some outbreak investigation, and they have some in vitro diagnostics. I want to be fair to them. They're very smart people. But there's something up here. We describe in our book, if you put the WHO, and the WHO is bigger than the CDC, and all these other organizations, we're talking trillions of dollars.
Mhm.
Trillions of dollars. CEPI, the Coalition for Epidemic Preparedness and Innovation, is one of the best to look at. Look up CEPI if you can. They have a business plan. The business plan says there will be one pandemic after another. They wrote it in 2017. And for each one of these pandemics, there's going to be one answer: global mass vaccination. They're in the business of vaccination. CEPI, they're preparing for future pandemics. They don't even give a shot at treatment. The only answer is going to be a vaccine.
In your estimation, when do you think we'll have another pandemic like this? Or another outbreak, massive outbreak?
Anthony Fauci, Ashish Jha, who is a former White House coordinator, Peter Hotez at Baylor at Houston, Jeremy Farrar, who was at the Wellcome Trust, now he's the chief scientist at WHO. They all say, CEPI says it's imminent. It's imminent. In fact, look up CEPI disease X. They call it disease X. I said, listen, it's going to happen. We're just going to call it disease X right now and get ready for it. Because there are so many biolabs making these creatures, these pathogens. It's a matter of months or years before another one comes out.
So you think there's going to be another leak?
For sure.
Okay.
Either leak or, if a nefarious...
X, there you go.
There's disease X.
Interesting. Can you look at that logo to your right? That's an interesting logo.
Don't go there. Don't. You're going to do cryptography?
No.
No.
I mean, I'm looking at this logo for the very first time, and instantly like this, that's just what's sparking into my mind.
Are
It doesn't look very lighthearted,
are you
or
saying it looks evil?
it looks demonic. That's what it looks to me,
Oh my gosh.
you know?
Well, listen, there's some iconography here, and this is a New York Times bestseller. Vaccines, Mythology, Ideology, and Reality. Look at the coin, Joe.
The Vatican,
This is
okay.
a 20 euro coin issued by the Vatican in 2022.
Okay, here for
A real coin.
for everybody who
It's a
can't
real
see
coin.
it, here you guys can take a look at it
It's a boy,
with a mask on, with
the
a
mask.
nurse.
He's about to receive the Eucharist. This is the classic tripartite configuration.
He's getting vaccines.
Instead of receiving the Holy Communion,
Yeah.
he's getting a vaccine. What does this tell you? The vaccine replaces God. The vaccine is the Savior, not Jesus Christ.